Well, hello. It's Bruce Williams again. It's a beautiful Sunday here in Bethesda, Maryland, and unfortunately, I'm still inside, sheltering in place. So I thought, why don't we do another Growth Path Challenge? Well, it's Growth Path Challenge number 63. As you can see, there's some classic lesions in here, and a few that may be new to some of you. So let's begin. Slide number 1 is tissue from a puppy. Can you give me a morphologic diagnosis, a cause, and a differential diagnosis for this lesion? What a great picture this is. Time's up. This is obviously kidney. We have multifocal to coalescing red patches of hemorrhage underneath the capsule. Remember, whenever we see hemorrhage, we want to think about necrosis, and we'll be right 99 times out of 100. So the morphologic diagnosis that I am looking for is multifocal to coalescing renal necrosis and hemorrhage. If you want to say multifocal coalescing necrohemorrhagic nephritis, that's perfectly fine too. Now, the fact that I gave you a puppy, I'm trying to steer you in a correct area, and the most likely diagnosis in this particular case in a puppy is canine herpes virus type 1. Remember, most of the herpes viruses, they like to affect the outer parts of the body, the skin, the genitalia, because they like it a little colder. Most of them don't do very well at normal body temperature. And because of this, canine herpes virus type 1 usually affects puppies within the first 7 to 10 days of life when they don't regulate their body temperature very well. So it's usually a little colder than what their normal body temperature is going to be, 101.5 when they're adult animals. And then after about 10 days, you'll see this very much. Now, canine herpes virus type 1 in the dog has 3 tropisms, which are pretty important and give us the lesions that we see. One is endothelial cells, and most of the hemorrhages that you will see in this case are in the endothelial cells of the glomeruli, sometimes in the capillaries. This is a difficult disease to find good inclusions, but if you're really lucky, you may see 1 or 2. It also likes to go after the proximal tubular epithelium as well, and you may see some necrotic cells within tubular epithelium. Now, the differential diagnosis and another virus that will affect puppies, but for a bit of a longer window, is canine adenovirus, because it is also endotheliotropic and likes to go after the cells of proximal renal tubule. You will see very similar lesions. In addition, that particular virus is hepatotrophic as well. So you will see necrosis on top of hemorrhage in the liver. You can see hemorrhages throughout the body in those animals. A great place in animals with canine adenovirus type 1. Remember, there are 2 types. Type 1 generally causes hepatic necrosis. Type 2 is a milder disease which tends to affect the lungs. That's one which we used to use before subunit vaccines came along to vaccinate against the more severe canine adenovirus type 1. But a great lesion, before I lose that thought, is if you see hemorrhage in the brainstem of a dog. I want you to think about canine adenovirus type 1. Okay, moving on. This is tissue from a thoroughbred horse. Can you give me a morphologic diagnosis and an associated condition? Okay, time's up. Hey, when I give you the extra information, like a particular breed of horse, that's very important. Otherwise, I just say horse. So we are looking at the articular processes from the cervical vertebra in this horse. I also want you to see that the spinal canal is a little bit asymmetrical and compressed. The lesions are here and here on these facets, and these lesions are associated with osteochondrosis. The morphologic diagnosis would be cervical vertebral facet osteochondrosis, and the associated disease is cervical spinal myelopathy in thoroughbreds. There are a couple of different forms. One is static stenosis, which you see in older animals, and you do have this permanently abnormal shape. There are some other changes that you might see in those as well. There's also another form of cervical stenosis, which is only seen when the head is pulled down, the vertebrae are subluxed. But this is probably a case of static stenosis. There was a wonderful article written in 2015 in veterinary pathology by Dr. Jennifer James, where she and a group of radiologists looked at these lesions both by imaging and in pathology and correlated them with cervical spinal myelopathy in thoroughbred horses. So if you're not familiar with that paper, I recommend that you go back and pull that one. Jennifer James in Veterinary Pathology 2015. Slide number 3 is tissue from a cat. Can you give me a morphologic diagnosis and a cause for this lesion? Okay, time's up. I could have gone just about anywhere I wanted. I could have asked for clinical pathologic abnormalities or associated lesions. This is a classic lesion in a cat. And we're looking at an abdomen that is full of a high protein, honey-like exudate, which has fibrin strands in it. There's a lot of ways you can go. I have always used the morphologic diagnosis, a diffuse, exudative, and fibrinous peritonitis with high protein exudate. I think that covers everything. Boy, the protein in this is so thick, it's sort of like jelly. If you put it in formalin, it's going to coagulate. It's going to have some yellow-looking jello material, but this protein is usually well over 2.5. It's up there around 4.5 or 5 or even more. That's why this is an exudate and not a transudate. Transudate is usually less than 2.5 grams of protein. And you can see little aggregates of fibrin all over the place. This is the wet form of feline infectious peritonitis caused by a mutating feline coronavirus. Remember that all cats have feline enterocoronavirus. It just comes with being a cat. And in the vast majority of cats, it's never really going to cause any problem. In a very small percentage of cats, especially some types of purebred cats, like Siamese and Burmese, that virus will mutate. It will mutate within the individual. It's not a contagious disease, but that virus mutates due to a change in one particular gene, and it gives it the ability to survive within macrophages. Once it can survive within macrophages, it becomes a persistent infection. These persistent infections, the animal responds to them. It produces a lot of antibodies, but they're not neutralizing antibodies. So you get this tremendous production of antibodies. The virus continues to produce because macrophages can't kill it. So you got this massive increase over time in viral antigen and this massive increase in antibodies. And eventually you get to the point in this disease where the number of and the mass of antigen antibody complexes starts to precipitate out of solution, and it goes into the walls of blood vessels, rendering the blood vessels extremely leaky, and they start to just pour out this high protein exudate, which obviously contains fibrinogen, which in the extracellular space will polymerize into fibrin strands. These animals, in terms of clinical pathologic abnormalities, generally have a very high gamma globulin count, 6, 7, maybe even 8. And we're not going to talk about the dry form. We've talked about it in previous lectures, but just a fantastic case of an exudative abdominal serositis or exudative peritonitis due to mutated feline coronavirus. Well, the PowerPoint wants to move on to the next one. I think I can indulge it. This is tissue from an ox. Can you give me an etiologic diagnosis and a cause? Okay, So an etiologic diagnosis is a little different than a morphologic diagnosis. It's sort of an old-timey way to diagnose something, and it's always composed of two words. That is the organ and the agent, and that's it. And you can flip around, you'll be agent and organ. That's good too. What we're looking at is cross-section through trachea. We're pretty high up in the abdomen, so it looks like proximal trachea. And in here you see some froth, which contains a lot of nematodes, probably adults, probably larvae and eggs. And this is washed up. This is not a normal spot. Normally, they're down in the bronchi, but when an animal dies, you get a little bit of froth, especially if it's sitting around. What that's done is taken all of those nematodes and it's washed them up from the bronchi and the larger bronchioles. This particular nematode is the only nematode that completes its life cycle in the ox. This is a trichostrongyl. Interesting, most lungworms are metastrongylus, but Dictyocollis in its various forms in ruminants is a trichostrongyl. This is Dictyocollis viviparus. You can also see infections in small ruminants, sheep and goats, with a related parasite, Dictyocollis filaria. But this is Dictyocollis viviparus, and the adults, the larvae, and they lay their eggs in the bronchioles. Okay, back to my neighbors are moving, so they're making a bit of a noise. So we're talking about Dictyocollis viviparus, a trichostrongyl that lives in the bronchi. The one big happy family, the adults, the larvae, and the eggs are down the bronchi. Supposedly, they're going to get coughed up, swallowed, and then passed into the environment. They don't cause a lot of lesions. Dictyocollitis is a little bit more severe in cattle than the comparative diseases in small ruminants. And if you get a very heavy infection, you may see mucus hyperplasia of the lining of the caudal bronchioles. And then what you get, very similar to what you get with other lungworms in small ruminants, is you may have these triangular shaped areas of atelectasis and depression, which are a little bit greenish because of the eosinophils that are incited to join the party when you have a large parasitic infection in the lungs. As we said before, this is sort of an atypical presentation. These got washed up. This is not a normal. They don't usually hang out in the trachea, but they got washed up, so you can see that. And it was a nice presentation. So Dictyocollis viviparus in cattle. You can also see an eosinophilic pneumonia in these that are associated not with the presence of the adult worms, but the migration of the larval forms in and around the capillaries to the lungs, and ultimately they get into the airways. So they can cause disease both as larvae or adults. Slide number 5 is a great picture from Dr. John King. And he used to carry this paw around with him as part of his show and tell for many years. And this is tissue from a mink. Can you give me a morphologic diagnosis and a cause? Okay, time's up. I would say that the one on top is a normal control, but it's sort of abnormal as well. It's probably from the same mink or maybe another mink on the farm, but there's no doubt that there's a problem going on. This is a diffuse severe hyperkeratotic pododermatitis. Remember I said, if you're not the most creative person, dermatology or dermatopathology is probably a good specialty to pick, because so much of the stuff that we see is hyperkeratotic. You don't have to have a long list of descriptors for gross pathology. I don't want to get the dermatopathologist mad at me because I find it confounding. So many things under the microscope look alike. But if you have lesions, you don't have to have a tremendous number of descriptors. Ulcerative papular hyperkeratosis is going to cover a lot of the gross pathology that you see. But there are a lot of diseases that can cause this. Now, in mink, mink, and the other mustelids are extremely susceptible to canine morbillivirus, the virus that causes canine distemper. And it causes in dogs, as well as in mustelids, a condition that has been referred to over the years as hard pad disease. And that's what you're looking at right here. It's just a tremendous hyperkeratosis. If you take a biopsy anywhere in the pad or even the skin surrounding that, you are going to see some absolutely beautiful intracytoplasmic eosinophilic inclusions, as well as, when you get lucky, maybe some intranuclear inclusions. The viral particles hang out in the nucleus, but there's a lot of viral protein that will hang out. And so you'll see both intracytoplasmic, intranuclear, and you may get lucky enough to see some viral syncytia. Those are more likely reserved for visceral organs like the lung, but you're going to see lots of inclusions, in this case a hard pad. And I said that there are changes up here. Normally the pads of mink are pink, just like they are in ferrets. So when you start to get this yellow discoloration, then you're probably dealing with hyperkeratosis. You'll see hyperkeratosis in other parts of the animal's body, including the planum nasale, under the chin as well. But this is a great lesion. These animals, unfortunately, will die as a result of immunosuppression, usually as a result of severe bacterial pneumonias or diarrhea. They will scour. So any mustela will do that. Of course, canine morbillivirus has really increased the number of hosts in the last 15, 20 years. And so the big cats are susceptible. Primates, non-human primates, are susceptible. Marine mammals have their own variant of morbilliviruses. So dolphins and seals have morbilliviruses as well. And this is a virus that keeps on giving. Every year we find new species that seem to be affected by canine morbillivirus. But mustelids, probably number one. Okay, this is tissue from a rhesus macaque. Can you give me a morphologic diagnosis and a likely cause? I'm going to ask you for 4 likely causes. How about that? Because I'm just feeling full of myself today. Okay, so we're looking at rhesus macaque. We are looking at the colon. You can see this pretty skinny rhesus macaque, but this colon, and soft, sort of tough to tell. Whoops. But I think I can see these lines here, which correspond to the tinea on the outside. If we could see the outside, it'd be very easy to tell, because you see the tinea, which are linear or bands which go longitudinally down the outside the colon, or the haustra, which are outpouchings of the colon. This is sort of a tough one, so you have to put a couple things together. So we have a colon, and it is red. It is really congested. I would go so far as to say there's probably necrosis and hemorrhage in this one. And whenever I see a red colon in a non-human primate, the first thing that I'm going to think about is Shigella, just a classic lesion of non-human primates. We used to see it a lot more than we see it now, but and it causes very red hemorrhagic gut, and sometimes you'll get even luckier and you'll see sort of a yellowish green diphtheritic or fibrinonecrotic membrane on top. And I asked you for 4 causes, and that's sort of a just to see how many types of Shigella you know. The classic is Shigella dysenterii. That's a good one. Shigella boydii, Shigella sonnei, and Shigella flexneri are 4 different types of Shigella which can cause this lesion. We often see Shigella flexneri in animals that are immunosuppressed with simian retrovirus type 2. You can see a gingivitis. You can see this type of, and it's not just the colon. With shigellosis, you can see necrosis and hemorrhage all throughout the gut. You can see it in the stomach. You can see it in the intestine. You can see it in the cecum and the colon. So don't forget about that. A couple of other things that maybe would cause something like this: campylobacteriosis, Campylobacter coli could probably, in a severe case, could cause this. I usually reserve my red hemorrhagic guts for Shigella, but Campylobacter, I think, could cause this. I think it's a little severe for Brachyspiropylosa but that's another disease of macaques. And then the fact that this animal is so thin, I'm going to think about chronic wasting disease of macaques. Usually you don't get the hemorrhage or necrosis. There's a lot of edema, fluid contents, but just the fact that this animal is really, really skinny. I'm gonna throw that in there, but what I'm looking for is 4 types of Shigella, or maybe Campylobacter coli or Campylobacter jejuni. Both have been identified in causing severe colitis in macaques. The other thing that I would think about, if this was a New World primate, so a marmoset, a tamarin, measles virus, sort of an odd one, but morbillivirus in measles causes a very hemorrhagic enterocolitis. So, but that's a totally separate species. Oh my gosh, it really, the differences between old world monkeys and new world monkeys are just legend. They get very few of the same diseases. So, Shigella, red colon, Shigella. Oh, let's go with slide number 1, 2, 3, 4, 5, 6, 7. And this is a horse. Can you give me a morphologic diagnosis? Okay, time's up. This is metastatic melanoma to P1, P2, and P3. There's P3. Look at the coffin bone. It's almost all pigment. It's all melanoma. And there's some little patches here and here. It looks like it might be extending underneath the coffin bone. And this is obviously a melanoma. We have to look at the color of this horse. Now, this horse looks like it's gray-white. And there's a big difference between melanomas in gray-white horses, the classic of the Lipizzaner horses from Austria, and brown horses. These gray-white horses, which have this graying gene, have the ability to carry a much higher load of melanoma before they kick the bucket. They often start in the perineal area around the tail. They may go up in the tail along the spinal cord. They may be in multiple visceral organs. They can go to the bone, as we see here, but they live quite a long time. They're pretty well adapted to that. Brown horses, you get 1 or 2, you're done. So, so there is that sort of breed difference or coloration difference, but just a nice picture of a melanoma. The activity of melanomas in the foot is not like it is in the dogs, where if you have a digital melanoma, they tend to metastasize widely. These are metastasized here, probably didn't develop here, but it probably somehow got into the bloodstream and metastasized here and set up shop very nicely. So there we go, melanoma, and that's a fairly, hopefully, straightforward slide for everybody. And we have 3 more to look at. Okay, this is an older picture, but it's a great picture. And this is tissue from a heron. Can you give me a morphologic diagnosis and a cause? Okay, time's up. When I first started as a resident, one of the first places we got a call for sort of an all hands on deck at the National Zoo, this many, many years ago. And it was just all day, every day for a couple of weeks. We got all of these birds, and they were putting them down because they were all infected with mycobacteriosis. So this is multifocal coalescing granulomatous hepatitis. And this one is a great case of mycobacterial granulomas, Mycobacterium avium to speak. Most bird species can get Mycobacterium avium, and this one was just sort of spreading from cage to cage at the zoo, and that's a real problem. And we would get all these fancy birds and birds of paradise and waterfowl, and everything had to go, and everything had this. And I don't think they have this problem anymore at the zoo. You can always get some, some cases of Mycobacterium avium. Usually we see them in immunosuppressed mammals. Birds seem to be a little more susceptible, but the problem is these animals were all infected. Every time they would go to the bathroom, they would put a lot more into the environment, and just got to be a real problem. What else would I think of for this? Well, a heron I don't know that they get a lymphoid tumor. Certainly looking at this, if this was any type of poultry, I'd probably think about the possibility of avian retrovirus or avian herpes virus type 2. An older disease, which is called Heron's disease or colibacillosis, will give you cholegranulomas in certain types of poultry. Now they're thinking it may not be E. coli, there may be another bacterium that is causing that. And they haven't seen that in many years, but one of the manifestations of colibacillosis used to be granulomas, especially in the peritoneum. But when I see something like this, these hard granulomas in the liver, at least from my experience, I'm always going to think about Mycobacterium avium first and foremost. If you submit cases to the Wednesday's Light Conference, we get at least 2 or 3 Mycobacterium avium in the bird, especially the liver of birds, every year. They don't make it in very often. They have to be real special, and people think that it's sort of mundane. They don't pick them very much. So if you're going to submit Mycobacterium avium this year for your Wednesday's Light Conference submission, please don't. Give us something else, because we get a lot of these. Okay, slide number 9 is tissue from a dog. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We are looking at the tongue of a dog, epiglottis. We see one tonsil here peeking out. Here's the tongue. It should be a nice, healthy pink like you would see here, but it is hemorrhagic. There's some necrosis, and then this area looks like it is infarcted. Now, a couple of days ago, I showed you a picture of a cat with bilateral ulcers on the tongue, and I said that this was due to uremia and too much BUN in the blood. And this is another manifestation on the other side of the tongue, which you can see in animals that are also in chronic renal failure. And then you have elevated levels of BUN. And when it gets that high, it whacks endothelial cells, kills off the endothelial cells, and in the tongue you can get these large infarcts. If the animal survives, sometimes you'll see that they will slough the tip of their tongue. They usually don't survive because chronic renal failure is not something that a lot of animals walk away from. We also have all of these vessels that appear to be bleeding. So I think we have diffuse endothelial damage going on here, and it is the result of high levels of urea nitrogen circulating. It has nothing to do with the bottom of the tongue, with the story I told you about the caustic alkali bath that you see in animals where their mouth smells like pneumonia. But this is also uremia. Great lesion, especially this infarct, because remember, there's not a lot of vessels go all the way out here. You take out 1 or 2 big vessels, and then you will infarct the end of the tongue. And slide number 10 is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up on this one, and we are looking in the lateral ventricle. This whole brain's sort of flopped forward. It's pulled away from the cerebellum. I think it's just bad positioning. But within the lateral ventricle, we see a large granuloma. Not large enough probably to cause any neurologic signs. And this granuloma, these granulomas are very common in older horses. They're known as cholesterol granulomas. Some people call them cholesteatomas. Not a really good name because it's not a tumor. Or some people call them cholesterinic granulomas. I guess that's okay too. This is not the most common. The most common for those are usually in the third ventricle, but you can see them in the lateral ventricle. The ones in the third ventricle don't get to be the big size that everyone wants to take pictures of, but the lateral ventricles can get really big. Sometimes they will expand the lateral ventricle and cause hydrocephalus, and they can, in very severe cases, cause neurologic disease because of the size. But this one probably don't. It's a granuloma. If you look closely, it has a corrugated surface because these are all little tiny granulomas. So it's a big granuloma made up of little granulomas. And when, just like the name says, you look at them under the microscope, you can see these beautiful clefts or spicules of cholesterol. It's a breakdown product of cell membranes. It accumulates, and you see all these little acicular clefts within it. It's a horse thing. It's an old horse thing. And you can also see them in old bears as well. There is a condition known as cholesteatoma. in humans, and also you can see it in gerbils, but that's very different. It doesn't involve the brain at all. It actually arises, it looks very similar under the microscope. You get these granulomas with a lot of cholesterol, but it arises from the epidermis or squamous mucosa of the inner part of the ear canal, just in front of the eardrum, and the outer surface of the eardrum. And it gets big and inflamed, and sometimes it can cause a ruptured eardrum. That's also called cholesteatoma, but it's very different. So don't confuse the disease of horses and to little bit bears with the human condition. So cholesterol granuloma, and look for them in the third ventricle, where you're going to see them even more than in the lateral ventricle. And that brings us to the end of Growth Path Challenge number 63. Tomorrow, we'll hope to do another one. My neighbors should be all moved out, so we won't have that background noise, people moving and talking and all that. I apologize for that, but I really thank you for spending a little time with me today. And we will see you tomorrow for Growth Path Challenge number 64.